Good morning, everybody. It's very nice to see you today. Please take a seat. We will start. Actually, it's very nice to see you after 18 months without face-to-face conferences. It has been a huge... Well, I will quit the mask. I'm alone. So keep your distance. So it has been 18 months of pandemics, of course, without conferences, having a lot of online meetings. I'm sure all of you had these online meetings. It has been a huge challenge for all organizations, whether we are public or private organizations. And we are very pleased, very pleased to have you here. And actually we are filming today for the dissemination and the communication of the event afterwards, because some people, unfortunately, didn't have the possibility to travel to Barcelona. And so we are just filming that. So I wanted to ask you just to start, because we are here face to face and I'm very pleased to see you. Just if you can turn a bit for you and look at the camera behind and put your hands above and say hello to the camera. Hi, we are pleased to be here. After 18 months, it has been a huge challenge. So we are here again, partnering with Mobile World Congress, one of the biggest events in the world on tech, on digital, on mobile technology, and partnering with 4 Years From Now. 4 Years From Now has been, since the last year, one of the best platforms for supporting startups thriving and startup development, startup inversion all across the world, and specifically here in Barcelona. And we are very pleased to continue this partnership and to continue this work together. We really work very well together. And actually, the story of this event began a long time ago, because I count yesterday with the team, we are on 9 editions of this event, 8 of them in Barcelona, 1 in Shanghai, in China. So it has been a journey with the team, but with 4 Years From Now, we had a very nice journey and very exciting program again this year to show you. It has been challenging as well for ECHAlliance during those 18 months. Of course, we are a community. We were thinking at the beginning of the pandemic, what will happen? Will the community still continue to network, still continue to work together, to build projects, etc.? Actually, we were surprised to see that the demand actually for connection, the demand for networking opportunities, the demand to join the dots was increasing actually during the pandemic. And we had an expansion of this network. And you see on this slide that this network is now a network which is not very well represented by our name, because we are European Connected Health Alliance. Nowadays, it's not really only European, because we are in 78 countries, so it's a large network now. But it's been as well this year the 10th anniversary of the organization, so it's nice to see that this network is expanding, and actually the pandemic didn't break that. And again, our organization is about people, it's about exchanging ideas and transforming these ideas in real innovation, and changing care, and digital transformation of care is, of course, our main objective. So we are pleased to be here. If you're interested, join the community. I put you here a QR code if you want to join. And I'm really excited to go for this agenda. This year we prepare for you an agenda declined in 4 tracks, 4 activities we will have during the day. One is around COVID, of course, how we could avoid to speak about what happened for digital health during the COVID pandemic. Of course, it has been a huge game changer, a tragic game changer, I would say. It was at the same time a very tragic experience for all the world, but as well for our sector and our domain and our people in the community. It was the opportunity to put in practice in the real world for real challenges, the technology that have been prepared sometimes for 20 years. I think about the teleconsultation. It's pretty old technology if you think about it, but it has been really a tool for this pandemic. So first track we will talk about COVID. Second track we will talk about what is the raw material of what we are doing in digital, in whole sector, but in digital health as well. We will talk about data. Should we free the data? And if we free the data, how we should free the data? What are the good conditions? And we will have interesting speakers around this topic. A track as well, number 3, around tech for care. We will talk about different technologies, different approach, but not only from the technology point of view. You know us, in this event we try to have both a clinical and technological approach. We try to see what are the conditions of implementation, what are the conditions to make it happen in the real world, not only to talk about fancy innovation, but as well about real and tangible changes in the healthcare systems. And that's what we will try to do on AI and on mental health during this track. And the last track, but not least, of course, we will talk about innovation, because we thought that along this year we presented a lot of innovation, but actually the question nowadays is not so much what to do, because more or less everybody knows what we have to do to change the healthcare system and to digital transform this healthcare system. It's a question of how we do that. And innovation means from the idea to the market, to the patients, to really change, and to the professional, of course, to really change the system. So we will have this last track of the day dedicated to that, and we will have as well the opportunity, beside the great expert coming to us to explain that, to have some startups here in the exhibition floor and invite you to visit this exhibition floor. This year it's more than 65, I think, startups on digital health. It's impressive. Which are represented on the exhibition floor, so please do visit that. We will have some cleaning breaks because we have to clean the room, of course. So you can take this opportunity. It's half an hour, so you can go around and see what is available in the exhibition floor. So this event, of course, cannot be possible if we didn't have support by large players in this sector. We thank company Novartis and its program Biome, which is our headline sponsor this year, and we will have the chance in a few minutes to hear from them what exactly is this program Biome and which kind of opportunity you can leverage on that. We thank as well our other sponsors. I will mention DHWS21, GKV Servicios, the insurance company, and the EIT Health, and as well the pharma company Ferrer. Thank you very much, guys, because without you, of course, this event would not be possible. So.